In this video, we're talking about temporomandibular joint dysfunction.
What's up, everyone? Welcome back to another episode of Twins Talk Therapy. My name is Aaron.
And I'm Adam.
And we are twins who talk all things in the physical therapy, athletic training, and massage therapy field. And in this episode, we're going to talk about temporomandibular joint dysfunction. But before we get into that, just a reminder, everyone, please like, share, and subscribe to this channel and start spreading our channel around.
So what is temporomandibular joint dysfunction? Well, for short, it's called TMJ, and that's how everyone probably recognizes it. So temporomandibular joint dysfunction, or TMJD, is a condition where you have pain in your jaw and the joint of your temporal bone and your mandible, and that can be caused by osteoarthritis. It can be caused by tension in the muscles. And when we talk about the muscles surrounding the jaw causing TMJ, if they're tight, we're talking about three main ones, and that is the temporalis muscle that covers your temple, and it comes down and the tendon twists and inserts down on your mandible bone and it elevates the jaw. We're talking about the masseter muscle, that's the chewing muscle that bulges out when you clench your teeth, and that runs from below your cheekbone down to the bottom edge of your mandible. And the third are the pterygoids, that there's two parallel muscles, and there's two pterygoid muscles, and they're more on the inside of your jaw joint, and they can move your jaw side to side. So those three are the muscles that can get tight and that we're going to loosen as massage therapists. And the third thing that can cause TMJD is the fact that there's no articular cartilage on the ends of the bones in your joint of your jaw. So there's just a disc of cartilage. If that disc slips forward, then you'll get that popping or locking of your jaw. The popping is the disc slipping back into place. Locking is when the disc does not come back into place, it stays slipped forward. And then because those two bones on each side of the joint don't have articular cartilage, when they touch, it's bone on bone. And that's when people, their jaw will get locked. We'll go into ways you can treat that.
Range of motion exercises to start. So we've got a couple main movements of the mandible. First one is protraction, where you protrude your lower jaw out in front of your top teeth. So just kind of doing that. And then retraction is going to bring it back and bringing your mandible back into normal position. And then the last one is just kind of be a side to side, so kind of dropping your jaw open and then moving side to side. And again, like all the exercises, you want to complete a couple sets, maybe 10 to 15 reps of all three motions, and do this to help kind of loosen up that temporomandibular joint. So a common reason why we can get temporomandibular joint pain is due to a forward head posture, again, with the way the pterygoid muscles work within inside the jaw and the way those interact with the anterior neck muscles, or your neck muscles in the front of your neck. Starting to develop a forward head posture can cause some imbalance or some dysfunction within the pterygoid muscles inside the jaw. So working on getting that forward head position retracted and over your shoulders can subsequently cause your temporomandibular joint pain to decrease. And lastly, there's multiple different type of strengthening devices out there. They're usually some type of device that you can bite on this device to help increase the strength of the muscles around the jaw. So one other thing you can do to help decrease your temporomandibular joint pain is self-massage. So just massaging over that TMJ, that temporomandibular joint, and you'll feel if you open and close your mouth, you can feel the top of the mandible that connects into the skull, the cheekbone part. It'll roll forward, and that's how you know that you're on the joint itself. And so you just sometimes just open the mouth a little bit to relax the jaw, and then just kind of work in circles, working on that temporomandibular joint. The other thing you can do is go down and just massage on the masseter, which is this main chewing muscle. If we clench our jaw, you can see that muscle stick out. So again, just kind of going downward strokes over that the masseter. And then the last muscle to work on for self-care is the temporalis. So it's a fan-shaped muscle on the side of your head. Massage the side of our head, and you can kind of follow that down in front of your ear and then down just below your cheekbone towards the TMJ.
All right, so as a practitioner, what I'm going to do when someone comes in complaining of jaw pain, I'm going to be able to massage the same muscles we talked about doing on yourself, and that's the temporalis muscle on the temples. And you just want to massage that fan-shaped bone on the temples, go down all the way to the temporomandibular joint where it attaches. Then I can also slide down onto the masseters and do some cross fiber friction, because the fibers run up and down, so I can go side to side on that masseter. And then after you massage those two exterior muscles well, if you have a glove, which any good massage therapist should have gloves to be able to do intraoral massage, and to hit that third muscle group, the pterygoids, the practitioner takes his pinky, and Aaron, I'm going to have you slightly open your mouth, and you're just going to hook your pinky in, and this can be done with self-massage too. You can do it however feels comfortable, either your pointer finger or your pinky, and you go in and your fingers facing this way, and you're just pushing into the soft tissue right at the top of inside the cheek there. And you can have the person slightly open their jaw and engage, and then relax. And you just kind of do an arcing motion up underneath that cheek. And lastly, this technique comes from Eric Dalton from Myoskeletal Alignment Techniques. It's kind of a range of motion with the jaw. The practitioner is going to kind of hook under the person's chin, and then they're going to slightly have them open. You always want to make sure that they don't have any false teeth underneath, and you're going to hook your thumb on the back side of the bottom teeth, and then you're just going to gently distract. It's almost like a scooping motion, and you're just going to have the client just make sure they're relaxed, and then you can kind of deviate side to side with that mandible to do some range of motion, but you're just kind of distracting that TMJ. And that's all there is to that. Well, everyone, we hope you enjoyed this video about tips and tricks you can do to help with your jaw pain. And if you have any questions or comments about this video, leave them in the comment section below.
Or you can hit us up at twinstalktherapy@gmail.com to recommend any future video topics or to ask us any questions. And we'll see you in the next one.